Looked at this and thought, you lying toads. I can guarantee there's a whole... Look, I don't need to know about your bunions, but I do need to know people have got, you know, serious heart conditions, if you're on anticoagulants, if you have anaphylactic reactions to things. This sort of level of stuff is what you need to put through the appropriate paperwork for the, before the event. So in each of your boats you should have your medic, and they should know where everything is in your kit, so that you're not sort of throwing it out over your shoulder when you need to try and find something and you've no idea where it is. They should know who's got, you know, the health problems, even though they should really know if anyone's got any health problems, they're asthmatic or whatever. And they need to make sure that they brought their sort of medications, and you're not 36 hours go up going, oh, I forgot to bring my, you know, my blood pressure medication and my, you know, this and my asthma medicine and all these things that people seem to forget to pack in a hurry. And there should be people documenting their incidents as per your regulations. Okay, so as you all know, you've got your blue book, and then you've got your special regs, which is all your other bits and bits, and inside your special regs are your medical stuff. And we've got, here's the 2017 to 20, and as most of you know, from 1st of July we go on to the new regs. You'd be glad to know there is pretty much very little difference between, I don't think, the only difference is on page 50, I think there's a typo, where for the alcohol swabs they put 0, whereas in the 2017 it says 10, and I think they just forgotten to put the 1 in front of it. But apart from that, I had a little squiz today and I had them up side by side and couldn't really see any difference. So which is useful. There is a bit of a caution. They do say, I don't know if you know, there's that body diagram they've got. I don't know if you can see it there. This is very much an RFDS body diagram. If you're talking to either me or most of my colleagues in hospital and you started saying it was zone A, we'd go, what? So if you're talking to, a lot of times RFDS use this for a lot of their remote and rural stuff. You've just got to know that it's not really, I don't know why they still have it. I have mentioned it before that it's not very helpful, but they still have it. So just be aware, sometimes it's better to say right upper tummy, you know, rather than say it's zone D. So if you, and this is more for storage, particularly if you're up in Exmouth for a while, you know, if you think about a race boat when you leave it, sometimes the temperatures will just go up and up and up. And most medications will usually, like a lot of stuff will usually say it needs to be stored under 25. So you really need to make sure you appropriately store it because it won't last very long. And so usually if you're putting it in somewhere cool, whether it's your cool box or your fridge, if you're out racing, you're offshore and you're moving, it's a bit cooler and the air's going through, it's probably fine. The other thing to know is, of course, and it says this here, you can use equivalent medications. So if you know, there's a particular antibiotic it recommends, but you think you prefer to use this antibiotic, that's absolutely fine. And some people usually ask me, is this okay? Can I swap this for this? And I go, yep, that's fine. So as long as it has an equivalent purpose, that's all right. It doesn't have to be exactly the same as it says in the book. Pro rata increase, you know, if you've got a boat of 13, there's a boat of 3, you've got to think, and also pro rata for what you're actually doing and how long you're away. And really make sure when you talk to your pharmacist, most of the ones through here, I just got a lot of our stuff for endorphin, and I use the lady on Stirling Highway Pharmacy in North Fremantle. The pharmacist there, Yina, she does a lot of stuff for off the ships as well, so she's very familiar with doing that. I think also the Hampton Road. Most of the ones around here will have done stuff for ships, so they won't look at you strangely when you go and talk about what you need for an offshore kit. But do make sure you explain that it's for a first aid kit and ask them for a long expiry dates, because most of the time when you get an antibiotic, it's designed to be used then. So if it expires in a month's time, it doesn't really matter. But it does if you want it for a first aid kit. So you want to say to them, can I have the longest expiry possible? Because it just means it's more use for you. Because hopefully these things will sit there and never be used. But you know, then if they expire, you have to keep replacing them. It gets very expensive. So we'll talk a little bit about medicines, what you use them for, when you shouldn't do it, side effects. Just so you know, These slides will all be available through the club, so don't worry about having to take or write anything down. I'll get them to send the slides out for you. Okay, are you allergic to anything? And if you're going to your doctor, they will say, are you allergic to anything? And hopefully there's not too many people who are pregnant, but maybe worth checking. So, drugs, which is sort of the medical term for medicines, rather than what you get on the street corner, can be either orally, rectally, intramuscularly, or intravenously. Now, some of you will have medics on board, and they'll be probably happy to bring cannulas and drips and IV stuff, and that's absolutely fine. The average person who's not a medic is probably not going to do that, but there's certainly facilities to do that if that's what you've got on the boat. So, a lot of our medicines are oral. Even if somebody says you need to fast, you can still take your medicines. Sometimes people think, oh, if they said they're going to fast, I can't possibly take the medicines. That's not true. And they take a while to work. And normally when you've got somebody who's quite blatantly, hurting themselves and they've got a little dinner fork in their arm, and they go, well, it's all right. I'm thinking, well, it's going to be not all right in 40 minutes, which is about when the medicine's going to kick in. So most tablets will take about 40 minutes to work. So I usually say to people, if it's not sore now, it's going to be soon. And you probably should stop being brave and take tablets. There are some rectal medications, and most of the time used to be things that has genital suppositories, which are really good for seasickness. They stopped making them now. It's just a company thing. And to be quite honest, on a lot of racing boats, they're all designed to melt at body temperature, obviously. So they don't work very well. But there used to be that some of the, which is why when it comes to the opiates, there's a rectal opiate on the blue book, and I usually just say to people, just don't bother. It's probably going to be not very helpful for you. So the reason we give stuff intramuscularly, which is either your adrenaline for allergies or your opiate medications, is because it works quicker. So the onset, if you're giving in an intramuscular injection, is about 5 to 10 minutes. But there is a little bit of some cons, and this is what we're doing today, is we're going to inject these poor defenceless oranges over there, and you need to obviously make sure that you dispose of things like sharps appropriately, which is not over the side of the boat. That would get you +2 points, negative. Exactly. And you obviously make sure you don't stab other people with them. Okay, we talked a little bit about IV, and it might be that's an option for some boats, depending on who they've got. So what do you get in your kit? So obviously it's a Cat 2 race. The things that are recommended but optional is morphine and your staplers and your glue. So it really depends on how many people you've got. If you've got a big race boat, probably worth taking it. More people, perhaps more likely to get somebody injured themselves. If you're a smaller boat, you're happy not to, that's also fine. So it's a recommendation, but it's not an obligation. They all come with leaflets you can read. And it's also worth having a day kit, because generally what we say to people on the boats is, if you're going into the proper kit, prefer people just don't go and help themselves, mainly because when you turn around and you think you've got something, you realise you don't. So it's probably better to say, if you're talking to them, whoever's your medic on the boat, if you have to go into the proper kit, they should probably go through the medic, but put out a day kit so that if somebody wants a paracetamol or an ibuprofen or just something simple like a Band-Aid, they don't have to go and talk to the medic, and just have a little day kit that sits somewhere separately, that's nice and easy accessible, just a few simple bits and pieces. And it also means when you come to get your safety inspections and things, you know you've got the kit and it's all sitting there and it hasn't been interfered with and half of it's not gone. Okay, so most of you will know this for going through, but you've got pretty much, if you go through what the book's got, you've got about 5 days supply for one person of paracetamol, and the same for ibuprofen. Then you're going into your sort of paracetamol codeine mixes, which is your Pandine Fort, and that's about 2.5 days, and that's really a moderate injury, so people with smaller fractures or nastier soft tissue injuries. Sorry? The minor amputations, yeah. So you've got about 2.5 days supply, so depending on how many people you've got, this is where you can think about things like pro rata, if you need to increase it up. And then you've got your opiates, which is oxycodone, which is endo, and then you've got so you've got 20 of those, and usually it's one tablet, about 1 to 2 tablets about 4 times a day, or 3 times a day, depending on how sore people are, how big they are, what injury they've got. The suppositories, which you can either have the tablets or suppositories. I probably would say don't worry about the suppositories. I just think it's an extra problem on the storage front because they tend to just melt. And if you've got the tablets, plus or minus if you've got the injections, you probably are covered. And then the injections are the optional, and then it's 10 milligrams per mil, and usually giving half a mil to a mil. But hopefully if you're having to give opiates, you really should be talking to somebody who's used to telling you what to give and how to give them. Now, side effects of opiates tend to be sort of nausea and vomiting. And often if I'm giving them, particularly if someone's an injury, I'll often give an anti-sickness medication at the same time, just to sort of cut that off at the pass. And the reason if you're having them morphine, the IV morphine, you have to carry the naloxone on board as well, and that's because that's a reversal agent. And the reason for that is opiates, it's very hard sometimes to work out exactly how much somebody needs, because it's very much dependent on how big they are, how much they drink, what injury you've got, and their tolerance. So you can give somebody 10 milligrams and they're still walking around looking at you, and you give someone else 10 milligrams and they're sort of claps in a heap. So that's why because of that, that's why you've got the reversal agent, so that if you need to reverse it, you can. You can give more, which is why I sometimes say to people, sometimes if you're not sure, you give the 5 milligrams, say, of the IM morphine, because you can always give more, but you can't obviously take away what you've just injected. If you're looking at your oxycodone, we've had a chat, reasonable dose is 5 to 10, depending on what's happened. The rectal one is about, sort of every 3 or 4 times a day, but generally I would say I wouldn't worry too much about it, but it is there in the book if that's what the preference is. And the IM injection is usually repeated every couple of hours if needed. And this is where if you have somebody medical on board, they might prefer to do an IV, so put it into a drip and give it intravenously. And that's because actually that's much more titratable, because you can give a couple of milligrams and wait for a minute or 2, and then you give a couple more. And then that has a quicker onset and quicker offset, so it's actually, if you know what you're doing, it's much easier. Okay. So naloxone is the reversal agent, and that's 1 vial, which is your 400 mics, and normally you just give the whole vial. If you've got a doctor that might give you the IV, the only thing to realise is that half-life of the naloxone is shorter than the half-life of your opiate. So if you give it because somebody's, stopped breathing, you have to watch because it will wear off before the opiate wears off. So you might need to give it again. Which is why you have more than 1 vial. I don't want to worry you, but this is just to let you know.
That worries.
Okay, so cardiac emergencies, hopefully people have told you that they've had 3 bypasses rather than just let it as a nice surprise halfway up through the trip. So you have aspirin, and actually aspirin saves more lives than going to the cath lab for a stent. So aspirin, and you've got your spray as well, which is under the tongue, can drop people's blood pressure. So if you're giving them some GTN spray, usually make sure they're sitting or lying down so they don't just go. This is where you can get equivalent. You can actually get the nitrolingual spray in a tablet form, which actually lasts a lot longer because the spray doesn't have a very long half-life. So it's just worth remembering that you can get it in a sort of tablet form as well, and that's equivalent, and that's fine. And they might need morphine if they're in a lot of pain as well, but that, obviously you talk to the race doctor. So eyes, usually chloramphenicol ointment is good for eye infections and grazes. And it's also quite a good sort of second one if people have got little nicks that get infected or little coral cuts. It's actually really good. You don't just use it for eyes, you can use it for other stuff. So little coral cuts that get infected can be, and that should say minor skin infections. Ossie's just dropped off the bottom. And that's is pretty useful. So on this you've got ciprofloxacin, which is the cat one, and then the others are cefalexins for your cat 2. If you're going up somewhere for quite some time, and particularly if you're thinking coral cuts, marine infections, ciprofloxacin is actually quite a useful one to have. So I would say if you're up there for a while, particularly people who are going cruising, people who are away for longer, ciprofloxacin is quite a very useful. It's a very broad spectrum antibiotic. So I'd probably say, you know, for those who aren't just going for a few days, that would be quite a useful one to have. Other useful ones are augmentin Durafort, which is, the reason it's not in the Blue Book is the Blue Book will try to remove all penicillins because they're trying to make it a bit more universal and, you know, to cover people who are penicillin allergic. But if you've got a whole crew and nobody's got any allergies, it's fine to take it, and it's a really useful, very much more broad spectrum antibiotic than cefalexin. So that's quite a useful one to have. And doxycycline, again, is very useful for marine infections, cuts and abrasions. The only downside is some people get photosensitivity with it, so it's not the best one for a yacht. But depends, you put them downstairs, don't show them, bring them up, make them do night shift. Alrighty. Okay, so Cipro we've talked about, it's got good cover, including for things you hopefully won't have in your boat, like gonorrhea. So cefalexin is a good skin antibiotic, a chest and urine infection antibiotic, and it's, if people are anaphylactic to penicillin, they can't have it, but if they have just a rash of penicillins, it's fine. Augmentin Durafort is a penicillin-based, which is why it's not in the book, but it's actually, if you don't have anyone who's allergic to penicillins, it's a very useful antibiotic to have. And it's also once, twice a day, so it's easier for people to remember. And doxycycline is another one that's really good for coral cuts and chest and skin infections. Okay. Cotrimazole cream is good. It's sort of an antifungal. It's good because, I mean, this isn't a long race. This is more thought of things like the barley race, where you're going to get a lot of, what used to be called, it was a yachty spotty, yachty botty grotty. Yeah, something along those lines. You know, when they used to get the combination of sort of humidity and dampness, and people not changing their clothes, and they'd get a sort of a dermatitis and then have a fungal and plus or minus bacterial infection. So an antifungal cream like cotrimazole is quite useful for that. And then you've got some diarrhea, which is also something you want to avoid on a boat. The only problem with taking loperamide, which is Imodium, which is sort of antidiarrheal, is if you've got a bacterial infection, slowing down the gut transit can mean you keep the germs in for longer. But it's a little bit of a, you know, it's a bit of a balance. Because other people probably want to use that toilet at some point. It's usually not multiple on the boat. Okay. So you've got gastrolite for dehydration. Oh, another thing on this, okay, sorry. Prevention is definitely better than cure, and that's the same for most things when it comes on boats. If you can stop yourself getting this, you know, if you can make sure you've got good hygiene on the boat. And some, have to say, having been on quite a few boats, some people are really poor. You know, all those things you got told to do when you were a child, like wash your hands before you eat, when you've just been going around bilges, washing, you know, and then you go to eat and you don't think about it. Or even worse, you make food for everyone else, and you don't wash your hands. So hygiene is your friend. Also treating things like seasickness early, you know, and the seasickness is, again, it's a bit like those teenagers going out and they need to preload before they go out. That's the same with seasickness. If you preload, I've only actually been sick on a boat once, and that's my own fault because I looked at the forecast and didn't preload. And as soon as I got sick and took a tablet and then waited for it to work, it was okay. But if you preload, it's always better for seasickness. If you think the weather's going to be bad, just take it beforehand. All you've done is perhaps taken the medicine, but you know, it's far better. And remaining hydrated, you know, if you're feeling nauseated, little and often, So there's lots of seasickness options, and to be quite honest, it doesn't really matter too much which you have. You can have a mixture of some, whatever works for people on the boat. There's prochlorperazine, which is Stemitol, which is a script one, but you can get that in tablets, or you can get that as an injection as well. You can get ondansetron wafers are good for. They're good for the nausea, but they're not good for the other things to do with sea. Ondansetron wafers, which are good because obviously they dissolve onto the tongue. They're very good, but they don't work for all the other things to do with seasickness. So all of this sort of that horrible feeling that people get and with seasickness, they don't work as well with. People who have stuff from the UK, so they have scopolamine patches. And promethazine, which is one of the old-fashioned sort of dirty sort of antihistamines, which has a little bit of different types of action, is also very effective, but it also can be a bit sedating. But if they are, you know, already indisposed, it doesn't really matter. You know, you may as well give them something, put them in the bunk, let it get better. So I'll come back. Seasickness is one of these things that we don't understand absolutely, which is why we haven't got a perfect cure for it. It's the imbalance between what you see with your eyes, what your proprioception, so what your joints are feeling and where you are, and what your ear is feeling. And that imbalance is what makes people seasick. And it's fatigable, so if you're usually about 36 hours or so, you know, most people will actually it will actually reset itself and people become accustomed to it, which is why people usually get better after a while. Most of the medicines that work best for it are those that dampen down those neurotransmitters, so that you dampen down that response sort of in the brain. It's also one of those things, apparently kids under 2 get it less, because I always think it's because they're always falling over. People who are migraineurs, people who are pregnant, will tend to get it worse. And also it's one of these things, if you're cold and if you're tired and if you're afraid, all those things, you will always feel it worse. And they've lined up a whole load of naval recruits once and sort of said to half of them, this is what you experiment on, it's going to be terrible and you'll all get sick. And the other half, they said, it's going to be terrible, but you'll be fine. And statistically, significantly more were sick, and the ones you're told you're going to be sick, you will be. So there's definitely that part in your brain of your brain making it work as well. Okay. This is in the kit as well. There's promethazine, which is Phenergan. Now, in the book, it says 25 milligrams. I wouldn't get 25s because you'll just knock people out. It's actually quite a big dose. So if you get 10 milligram tablets, and you can just increase it as you want to. So if you get somebody who says, oh, I take 25, not a problem, you give them 2 10s. But most people will be quite sedated, and it has quite a long half-life. It's about 18 hours half-life. And it's also a good antiemetic, and it's also a good antihistamine if people have gone and got jellyfish stings or something that they need to take it away from. And you've got adrenaline in there, but this is really for anaphylaxis and allergies. And you've got usually 5 ampules in your packet. Adrenaline is the one that, even with the best will in the world, the half-life is actually is not very long. So even if you ask your pharmacist for as long as you can get, it's still one of these ones that ends up having to be replaced quite often because it doesn't last very long. And normally if you have someone with an anaphylactic reaction, you'd give them half a vial, which is half a mil, and usually it can be repeated if you need. Okay. Other things which are useful, particularly if you're going up and you're spending some time up, or if you're cruising, is eardrops for swimmer's ear, because that can be really painful. And oral antibiotics have a very poor penetrance to your outer ear, which is why drops work better. Other things are like eye gel drops if people have eye injuries or abrasions. We talked about ondansetron wafers. Sometimes, particularly if you're away people who are going away for longer, having the Bactroban, which is the anti-staph ointment, is really good for sort of infected nicks and coral cuts and so on. Other things, it's quite good to have because you've got a sedating antihistamine, which is your Phenergan, but actually having non-sedating antihistamine is also good. And Kenicone ointment is also quite a good one to have, which is it's a combination. It's a sort of a steroid, an antifungal, and an antibacterial. We sort of think of it as the cream for the diagnostically challenged. You can't work out what it is, you can just put this cream on. Other things would be just, and in fact, interesting enough, they put like Gaviscon and Mylanta, which they antacids, in the Cat 1 but not in the Cat 2, which I don't know why, because it's not exactly expensive, and it's quite useful if people get a bit of gastritis that they can just have some Gaviscon. Other things you can take, I don't know if you can see, but for those particularly going for longer, you can get little emergency dental kits, like that. I got this from the pharmacy in Stirling Highway, but I think you can just get these online as well. So for those people's crowns or fillings fall out halfway up they've got those little kits. Just check how we're doing for time. Alrighty. So we'll talk a little bit about injuries. Basically, head injuries are quite common. People hit their heads on booms, etc., etc. If it's more than a minor head injury, they should go. There's no doubt they need to go off the boat. Either you take them off or somebody comes and gets them off. If they're on anticoagulants, and this is why we want to know if you're on anticoagulants, you get a bad head injury. If you come to a hospital, we will always CT your head. So if you have a significant head injury on an anticoagulant, you should also go somewhere where they can CT you. So minor head injury is where someone isn't knocked out, they can remember everything, they're not vomiting, they haven't had a fit, and they're alert and orientated, no severe headache. Anything else is more than a minor head injury, so should leave. Sprains, strapping tape is also a useful thing to put into your kit. Because you've got that sort of uneven surface and a boat refuses to stay still for you, you're more likely to get your sort of knee strains or your ankle strains, and it's pretty, having a strapping tape gives you actually much better than having a tube grip. And if you're delicate skin, you can put Fixamol underneath. Fractures, probably your arms, probably your most common ones, and sometimes your ribs. So generally, particularly if you've got hand injuries, most of the time on boats, very few people wear rings, which is probably a good thing, because you can't get them sort of caught in things. But if someone does wear rings and they've hurt their forearm, you should take the ring off as soon as possible, because it will just get more and more difficult as time goes on. And although you've got rig cutters, they're not as helpful for taking the rings off. Okay, pain relief. Most of you will have like the sand splints or other splints, and most yachties are pretty ingenious at making splints using bits and pieces and some gaffer tape and other bits. So everyone's very ingenious in what they can make work. Basically, if you've got a fracture, you need to, and this is what people talk you through. Is there a pulse? Is there sort of perfusion beyond that? Can they feel everything? Can they move everything? And obviously, if they can't, then they also need to go off your lovely boat somewhere else. That's a little tendon. Hopefully nobody's squeamish. Okay, open fracture just means bones through skin. And this needs antibiotics and also needs to leave to go off the boat. That's just lots and lots of swelling. Best done early. Sometimes people have had their rings on for 50 years and they've never taken them off, or in fact don't even know if they can. So you can use washing up liquid. You can use, there's a string method to do where you sort of, you wrap your string under and you sort of pull it up, so you're pulling your ring off, or you can try and get some sort of bolt cutters into it if you need to. Elevation, if you've got a significant injury, you need to put it up, the whole rice that we're always taught. And the most important thing often with most wounds is to clean them, and it really doesn't matter what you clean them with. You can, as long as it's not sewage water. If you bilge water or anything, as long as if water's fine, saline's fine. Don't put neat betadine on because that can be quite caustic. It can certainly be diluted. And you need to have it. If there's any foreign bodies in their glass or whatever, if they were having their sundown or when they fell over with it in their hand, obviously take it out. If somebody thinks there's something in there, they're probably right. If they think, I think there's a bit of glass in there, then there generally is. Okay. Well, generally in this talk, we're talking about closing wounds. Why do we close a wound? Because it heals better and stops bleeding on your boat. It gives you a finer scar. Particularly, often things you get scalp wounds, and scalp wounds bleed like stink because they heal really well. They've got a fantastic blood supply. But that's the reason really generally for the staplers, because often the wounds people get are scalp wounds. Staplers are a really quick, easy way of sorting them out, and then they stop bleeding. Okay, if it's a small wound, particularly if you're coming, if you're coming into coming up to Exmouth pretty quickly, and it's a small wound, then often you just give them a good clean, give them the bandages up, give them some antibiotics, get somebody who knows what they're doing to sort it out in a nice, sterile, clean environment. The only time you're going to be probably sorting it out otherwise is if you're a long way out, particularly for scalps that keep bleeding, or if you've got people who've got the skills and expertise to stitch, then they might sort it out for you. And sometimes little minor wounds you can glue really easily. So basically, if you're not going to sort it out, you need to clean it, you need to put a little saline soap dressing on it, or betadine, and then antibiotics, and then it gets sorted out when it's come off the boat. And the simple wounds are those that can just you can obviously see they're just tiny, and they just need something to seal them up and sort them out. To close a wound, the simplest thing is often glue. Glue it's very expensive. It's about, I think it's very expensive for what it is. It's $25 for this tiny little sterile vial. But anyway, I think they just charge more because it says medical in front of it. You can also glue your steri strips down. So when you close a wound with steri strips don't last very well on a boat because you're moving, there's water on, they just lift up. But actually if you glue your steri strip on one side, pull it over the wound, glue it on the other, it means that actually it's going to stay on longer and the glue just wears off. And so you can use that as a combination. And you can staple, that's what the staplers are for. And if you've got people who, medics or dentists, or an occasional vet, they'll often be happy to suture. So glue is pretty painless, a bit warm. It's usually for a low tension wound, so wounds under high tension, it's really not going to have sufficient to hold that together. Don't get gluing. Often you get wounds here. The idea is when you glue them, you lay them flat, so if the glue runs, it doesn't run this way, that way. And if you glue yourself to your patient or you glue your fingers together, you just have to keep going like this until it wears away. And it's good, easy stuff to have. I just think it's a bit expensive for what it is, but it's not the end of the world. So that's what we often glue, little wounds. And if you're doing that, say, on that sort of position, you definitely would do it lying flat. And generally what I do is I actually put a bit of gauze here and a bit of tape over here to shut the eye, and then I make sure when I glue it, it's always going to go that way. But generally up here, much easier, not anywhere near the eye. Like the little happy smiling face there. Kids are often what we do a lot of gluing for because they heal really well. It just holds, it's just, basically you clean it, somebody pushes it together and you just put a layer of glue on it, and that's as complicated as it gets. Steri strips are pretty good. Never shave the eyebrows. I know they do it at university, but apart from that, nobody should. Because even if they've got a cut going across here, eyebrows take forever to grow back. So, you can just work through the hairs. And actually, I don't really bother to shave if I've got a scalp wound. You can just work around it. You don't need to shave anything. You can also use, obviously in the kit, you've got your steri strips. Fix-em-all can also work, and I've just done little fix-em-all strips here today just to use. Fix-em-all is really good. You buy it in boxes and rolls in the pharmacy. It stays on when it's wet, which is always a good property. It will come off with oil or sunscreen, so if you've got something oily, it will come off. But if it's just water, it will stay on really happily. And also, the other thing you just need to get when you're getting your first aid kit, and it sounds silly, but make sure your plasters are waterproof, and they stay on, or they're fabric, or they stay on when they get wet. There's no point having ones that just float off as soon as they get wet. Sorry? Exactly. So glue and steri strips are a good combo. Staplers are really easy, and to be I know sometimes in a hospital we put local anaesthetic in first, but I think the local hurts worse than the staplers. So, and you wouldn't do it for the face or for the hands. There's too much stuff in the hands, you might staple on the tendons, and obviously you don't want to do it on the face. So that's pretty much, we'll do a little demo. But it's really easy. To staple is really easy. There's a few things you just need to look for. You obviously clean it beforehand. If there's a scalpel, there's a great big blood clot in that clot needs to come out. So you need to hoik it out first before you staple. But does really well for scalps like that. If you do that, you can then just do that, and that's just easy. And that, you're feeling more adventurous. So sutures are good. You've got people with the expertise to suture, they're often the way forward. Staplers, generally, it's not a problem for what you're doing, but if you're doing a lot of longer stuff and cruising, most staplers will come out in sort of a week to 10 days, and there's a little stapler remover. So if you're just going up to Exmouth, there'll be, a place at the other end where you can get your staples taken out if you need to. But if you're going cruising, you probably need a removal device, which is just a little instrument that just picks up the staples. Okay, and obviously you need someone to have a look at the wound when you go back to civilization. I don't know. I've got obviously some to use tonight, and I've got a few which I'd ordered actually for the barley race. But I don't know if people want more, if people have already got theirs for the last race. I can probably order some more, and I've got some glues. If people want them and they want to let the office know, perhaps in this next week, I can probably organise some if people want some for their boats. But I know that not everybody will want them, so I know they're roughly around the $25 mark, I think, roughly. So if you just let the office know, we can probably try and sort that out for you. So iron injections we're going to talk about a bit. It's always good to get, particularly you don't have too much injectables, it's always good to check with somebody that you are actually giving them morphine, not adrenaline, or vice versa. Particularly if you're doing this in a bit of a panic and a hurry and you've never done it before and you're a bit worried, and so make sure someone else looks at you and go, oh yeah, that's the same. You won't need to check the expiry, hopefully, for this sort of race because you'll have done it before you leave. Pretty much we've all got hand sanitizer everywhere, so do make sure you clean your hands and wear gloves. And we'll talk about opening the vials. I'll show you when we've got it, but for the glass, I've got a few ones here. I've got some plastic ones that you can just practice drawing up and injecting with. And when I've only got a limited amount of the glass ampules, which are the expired medicines. The glass ampules, most of them, they have a little, on the neck, they have like a little white dot. So if you line the white dot up, and normally, ideally, you'd either have gloves or a bit of gauze, because sometimes if you do it with your bare hands, you can cut yourself, which is usually not a good idea. And try not to crush it in your hurry. If you've got great big sort of yachty hands and then you sort of crush the thing. Drawing it up, and often places like the sink are a good place to do it. You stabilise, you've got somewhere to put things in. And also it means you can drop your needle in there while you're sorting everything out, and then you can dispose of it appropriately when you've finished, but at least you've got somewhere to put it and it's not sort of rolling around the floor, stabbing everybody. So, for the iron injections, as you all know from getting your immunisations, normally you get them either in your upper outer arms, or if you're very lucky, you get them on the bum. But most of the time, there are points you've got to do and learn. Like for the bum, it's got to be the outer, to avoid getting the sciatic nerve, you've got to have the upper outer quadrant. So most of the time, we teach people the same you do for all of your kids that have the adrenaline pens, the EpiPens. We usually say that the outer third of the thigh is the easiest one. It's a good chunk of flesh. You've got nothing to worry about running there. That you can vessel. There's no vessels running out there. There's no nerves. You're not going to hurt anything. So usually we just say, really, it's just there. It's the upper outer third of the thigh. So it's about there for those. So it's about there, and that's probably the easiest one to do if you're giving an iron injection. And can I just give a little pump for hygiene on a boat? Some people are fantastic, some people are in the middle, and there's a few people that are terrible. So personal hygiene, boat hygiene, chef hygiene, washing your hands, you know, loads. We should all be used to hand sanitising to the nth degree by now. So just make sure you do it. And although sometimes people think it's sort of a badge of pride to wear the same clothes for 3 weeks, it's not. Right. So this is, if you go and get your medication, particularly scheduled medication, it's done under a particular part of sort of the regulations for racing boats. So for this, if you go for this app, it then takes you, that sort of link, sorry, takes you to the supply of medicines to ships and vessels, part of the government, and then with that link, it takes you to the summary for pharmacists for supplying medicines to vessels, and we obviously come under the racing yachts, and and basically gives you the rules there, and then also in there is the pharmacist form that they do when they're doing particularly for instance, when I picked up my stuff today, because I didn't pick up the scheduled medication, which is your opiates, I did all the other stuff. I didn't need to do one of these, but this is what they do for the scheduled medications. So, which is your opiates, basically. It's all the addictive stuff. But that's how it works when you don't actually need a script to do it, because it comes under a different part of medication. I'll leave these.